All right, so here we are on day 2 of this ketogenic diet thing. And yesterday I kind of filled you in on what it was and some benefits that I've seen personally from it. So today I'm going to fill you in on more of the health benefits that come along with eating ketogenic. Now, I stated yesterday that like in the 1900s they used it for epilepsy. And, you know, that's kind of one of the oldest uses for it. So that's what stemmed people and started them to try to use them for different health issues. So, and then I did talk about type 2 diabetes. Now, there are 2 factors that come with it. We're eating a lower sugar, lower carb diet, and we're losing weight with it. So how could that not help type 2 diabetes? It's actually made it, and I've seen it happen, to where you can eliminate most of, if not all, of your diabetic medication with type 2 diabetes. Seen it happen. And those are the 2 different approaches that the ketogenic diet actually has on diabetes. Okay, so let's go into cardiovascular and metabolic issues and, you know, inflammation. Okay, so we've all been taught that, you know, low-fat diet is the better way to go. Can I just fill you in on just a little something about low-fat? That is a chemical shit storm. Because what do? They have to take the fat out, which, you know, if you talk to chefs and other people, fat kind of gives things flavor. So what do they replace that fat that they've taken out to make it low fat? Shit, crap, sugar, garbage, chemicals, okay? I'm not going into that. Just think low fat is not as good as we thought it was. And if you, once I will post yesterday's blog, you'll see where my doctor talks about it. And he failed on a low-fat diet. And his patients all failed on a low-fat diet. So it makes sense, okay? Here's the thing. There's a well-known cardiologist that actually says this inflammation from sugar and carbs is what clogs the arteries. However, it's hard for doctors to admit that they're wrong. I will post that article in my blog from this video. But studies today have shown that this eating low fat is wrong. You know, to where we've all been taught like, oh, if we eat, you know, saturated fats and fatty things and red meat, it's going to clog our arteries and cause heart disease. Not so true, okay? It's not so true. But just think about it. Think about anybody that you know with heart disease. How many medications are they on? And how many side effects, how many ill side effects are there to these medications? Just think about it. Think about when you watch a commercial for a prescription medication and they give really fast the side effects, the terrible side effects that come with it. Just think about that for a minute. So, you know, with this metabolic syndrome, they think that the keto actually messes up the metabolism, which actually, it improves it, it stabilizes it, it makes it better. So it's not making it worse. So these are things that are proven. I will post a link to a book that I'm reading on this, and I know a lot of people are like, well, what are the scientific studies? Well, let me ask you this. What are we doing studies on most days? Who are we using for these studies? Are we using people? 90% of the time, they're probably using lab mice and rats. So are they really consistent to what our chemical makeup is? I don't know. I don't know. Do you know? I don't know. When they're doing studies on humans, like I said, my scientific study was watching someone come off of diabetic medication. My scientific study was seeing the results that I got from it with the cholesterol coming down. That's enough scientific study for me, okay? Because I'm a human and I've done this and I've seen it change things. That's my scientific study. You know, they did a scientific study on if you tied your shoes a certain way, they wouldn't come untied. Who pays people to do these studies? Let me tell you, they're wrong. Because I tied my shoes that way, they came untied. So what I'm saying is, how are these studies inconclusive because they're put out on rats and not humans? You know, just think about that for a minute. You know, and think about what you've seen and what kind of diseases you've seen in them. Like I said, the medications that they're on. So here's something that they're showing that it's benefiting these chronic illnesses. Remember, I talked about this yesterday, that it reverses some of the ill effects of chronic illnesses. So like PCOS, polycystic ovary ovarian syndrome, I think is what it is. You can correct me if I'm wrong, in the PCOS is what it stands for. But they've shown that that has helped that. There's been great benefits from it. IBS, okay, a diet low in sugar eliminates the IBS. What's IBS? Inflammation and crap in your intestines, okay? GERD and heartburn. It helps that. Whole grains and sugar are the cause of heartburn and GERD. Your gut and what you eat is not like Las Vegas. What goes in your gut and what happens in your gut does not stay in your butt. Yes, polycystic ovary syndrome. Okay, so I was close on the PCOS. So, I mean, don't believe me. Don't believe the studies. Try it yourself. Non-alcoholic fatty liver disease. What causes the fatty liver? The sugars, the raising the glucose levels. If you're not putting that into your system, these things aren't going to happen. I just feel like we need to do homework on this. We need to look into it. Here's good evidence that it benefits Alzheimer's disease, Parkinson's, schizophrenia, bipolar, narcolepsy, and sleep disorders. It improves your exercise performance. Now, what I'm saying and what I'm reading and what I've researched over the years works for some and not others. But I will leave you with this. I'll go more into detail in my blog as to how it helps all these chronic illnesses and diseases that I've discussed. But I'm going to leave you with this one. And then you can chew on it for a while. And then I'll tell you what we're going into tomorrow. So chew on this. What if? What if what I'm telling you is true and it does work? And what if you tried it for 30, 45, 60, 90 days and noticed a freaking difference? What if you were able to get off of the medications that send you to get your liver levels tested every month, or your, let me just, I mean, my daughter was on these medications for a certain disease she had, or skin issue she had, sorry, and it could have messed with her liver. It could have messed with so many of her other organs. What if you could change that? Okay, what if you didn't have to take a pill that had side effects of, and I'm going to go a little advanced on this one. If you didn't have side effects of like suicidal side effects, or, eyes crossing, or blindness, or, anal bleeding, or whatever it is, listen to those side effects just in one commercial. And what if just by changing your diet, you could go off that medication, or you could share this with someone and say, hey, why don't you try this for 30 days? Experiment with it. Because, I mean, doing it for 30 days wouldn't kill you, but not doing it for 30 days could kill you. I don't know. Could it? Could it not? Seriously, guys, do your homework on this. Check my blogs. I am so putting all of the links that I'm talking about in the books that I'm reading in these blogs, so you guys can do your homework. I'm not trying to convince anybody, like I said, and I'm not trying to start an argument with anybody. But what I'm saying is, I've seen some of these things change firsthand. And when I see that happen and I experience it, I got to share it with people. So what am I talking about in tomorrow? Oh, not tomorrow, Monday. I'm giving you guys a day off to do some reading. So what am I going to talk about Monday? How do you get in the ketogenic state? What do you need to eat? What levels do you have to be at? And how do you know if you're at the right levels for you and for it to work for you? Okay, so think about all of that, and I will see you guys on Monday with how to get in ketosis. So you guys have a great weekend. And like I said, if you know someone who suffers from any of these illnesses or diseases or has these chronic issues, share this with them, show them. Then they can go do their homework. Then they can read my blog and see where I'm linking this to doctors that have started to use this. Goes against everything that we've been taught, but we're finding out that it actually works for some. Not all, but some. So why would you not want to give it an experimental try? Remember that, for 30 days. Keep that in your mind, because I've got a little thing going on for an experimental 30-day thing with keto. So I'm leaving you with that. I'm leaving you with the what ifs. So go ahead and do your homework and figure out, what if this does work? What if the people who are doing this and seeing benefits and results aren't crazy? What if? Think about that. And I'll see you guys in the next episode. Have a great day. Bye.